Why are we here today? At first, somebody might say, well, what does a receiver of taxes have to do with water? Well, there's a couple issues. First, I'm a resident. I care about my water, but I'm also looking out for the taxpayers in every means possible. And what is taking place could cost us millions upon millions of dollars, and the cost could be dropped in the taxpayers' wallets, and we can't afford it. The New York State Drinking Water Quality Council recommendations to the Health Commissioner outline strict treatment for 1,4-dioxane that could go into effect as early as January of 2021. To remediate this issue, districts primarily focus here on Long Island. That's where the main focus is, with the exception of a little area out of Albany, would have to embark on an expensive and a time-consuming treatment process. Water experts say that even if the work were to commence today, it would be difficult to meet the 2021 deadline. As a result, there are serious implications. One, if the wells don't comply with the new requirements by the deadline, they could potentially be shut down, meaning that's going to limit the availability of the water supply. In addition, since the cost of the treatment is not expected to be even close to that what the New York State is offering, that is going to be passed down to the local water districts or the town. And this is going to hit taxpayers where it hurts, right in their wallets. The town of Hempstead customers, for example, could see a doubling in their water bills. Every day of indecision by the Health Commissioner's critical day wasted, while our water supply districts could be implementing a protocol to get this process going. We need our state representatives in the Assembly and the Senate to address this now. Hardworking taxpayers deserve good water, good quality services, but a means to be able to afford these services. The more they wait, the more the state sits on this, the more potential impact for the taxpayers. Look, the state's got to step up. One, they should consider a phasing in of the regulations to allow the municipalities more time to implement this. In addition, people need to recognize that if all these water districts and providers are all required to provide this by 2021, the companies that will put these mechanisms into effect, they're not going to be able to cover all these districts at the same time. It's just not realistic. By extending it and putting in a phase-in period, it's going to allow residents a smooth transition into this process. Otherwise, these districts are going to be forced to scramble and potentially have to shut off water supplies.
The unfunded mandates will continue to cost the town of Hempstead taxpayer more and more money to make Long Island basically unaffordable. We need the governor and the state elected officials to step up, give us our fair share, and give us the clean water that we have. And thank you to all the water districts that work very hard to keep it that way. But unfunded, quick mandates will cost this township hardship.
Some people say, what's 1,4-dioxane? Look, it's a substance that's found, in a lot of cleaning fluids, detergents, shampoos, some cosmetics. And I said, we all want good, clean water. But we want our state at the same time to recognize that, a good intention has to be implemented in a fashion that is going to be realistic. And that's part of the problem that happens up in Albany. They say, we want this, here's a mandate, get it done, and they do not recognize the costs associated with it. And as I said earlier, most of this, the contaminant, is found on Long Island, with the exception of a small part out of Albany. And to think they're going to say, we're going to provide money and $3 million, statewide, it's just not being realistic. If the burden of the cost is going to be right here on Long Island, then Long Island deserves to have its more than fair share to implement this. And that's why we need our state representatives, the commissioner, and the governor to recognize this and do what's right.